I am Professor Dr. Manish Chaturvedi, presently serving as Head Department of Medical Care and Hospital Administration at National Institute of Health and Family Welfare, which is a Apex Training Institute of Government of India, Ministry of Health and Family Welfare. Today's topic is social factors and NCDs, that is non-communicable diseases. I will emphasize specifically on the subtopic community resources and support system. I will cover my topic under these 8 subtopics like introduction, risk factors, social factors, community resources, barriers and enablers, and policies and initiatives under non-communicable diseases head. Non-communicable diseases, which are chiefly cardiovascular diseases, cancer, COPD and diabetes, which are already elaborated in the previous sessions by other experts. But I must say that India is experiencing rapid demographic and epidemiological transitions, and there is a steep rise in the burden of lifestyle-related chronic non-communicable diseases in India. We have learned a lot about the risk factors of non-communicable diseases which are modifiable and non-modifiable, out of which the 4 factors which are identified as self-management risk factors, which are largely related with the self-management, are tobacco use, alcohol use, physical activity and food choice, which can be modified on the basis of individual efforts. Social factors and non-communicable disease play a key role in shaping the distribution of the major behavioral risk factors. As I have already shared, the key shared risk factors, which are tobacco use, diet high in fat, salt, sugar, physical inactivity and harmful alcohol intake or binge drinking, may lead to the occurrence of heart diseases, stroke, cancer, diabetes and COPDs, which is chronic respiratory obstructive pulmonary disease. These non-communicable diseases largely affect the Millennium Development Goals and Sustainable Development Goals, which leads to poor health effects, household effects and macroeconomic effects, which is a concern for all of us. In relation to communities' resources, which can be utilized for non-communicable disease management and prevention of the diseases, that requires a holistic effort and effective utilization of community resources by providing education, screening and treatment. If we are able to provide the education to the community workers and community members, then they will be able to help us in routine screening. They will engage people and enhance their awareness so that they came forward on their own for the purpose of screening and continue the treatment and adhere to the treatment guidelines. Community resources largely refers to as assets, the organizations and services. So we are dividing this community resources into assets, which includes the community assets, the organizations, the healthcare organizations of Government of India and private organizations both, and the services offered by them largely in relation to non-communicable diseases through the health workers in the particular area or the local site. Every community which is identified as a complex system with which interplay between multiple contextual factors and requiring engagement from diverse actors within and outside the community to protect, restore and improve health. Therefore, we have to utilize this complex mix of assets, organization and services so that we will be able to prevent and manage the non-communicable diseases in a community. As I have already elaborated, the community resources, providers and facilitators. Who will be the provider and who will be the facilitator? We have identified following providers who can deliver community-based health interventions at following sites, which includes a physician who will be available at a primary health center, the community development project officer or district project officers of ICDS program, that is Integrated Child Development Services program, can be approached for any need. That is one. The second one is the health worker locally available, which can be ASHA, community health workers, which can be ANM, community health officers, which are available at the sub-centers, which are renamed as Ayushman Arogya Mandir recently under Ayushman Bharat scheme. The fourth category is health educators or the medical social worker of medical colleges and district hospitals, Anganwadi workers, pharmacist and chemist, which are easily available and largely approachable community. Everyone wants to take treatment from their local chemist and local pharmacist, as these are considered as trustworthy practitioners because they are considered to be the professionals who know the treatment aspects as well as the disease aspects. The peer group facilitators, the influencers in your own group, the self-help group facilitators. The next category comes is the telemedicine experts, which are coming up recently, and Indian government is focusing on telemedicine aspects as post-COVID, during COVID era, we have learned the advantages and disadvantages of the telemedicine. Therefore, telemedicine experts, which are locally available, if any, can be utilized, which may be able to guide you about the government efforts through e-Sanjeevani for interaction with the healthcare providers. Family caregivers or NGO field functionaries, if any NGO is working in your area on non-communicable diseases, may serve as a guide for the purpose of interaction or to help you, to assist you for the right treatment and the right approach. And last one is the cultural advisors. Whatever culture in which you are nurtured and growing in that particular area can serve as a good guide and facilitator for the health intervention. The health promotion officers, the community mobilizers, these are the total 9 sites which are identified as the community resources for community-based health interventions and the guidance. The community health workers who bridge the knowledge gap by offering peer-to-peer education, referral, psychosocial support and care with clinical staff are largely the main core responsible functionaries available in the local area, may serve as the best guide compared to other categories which are identified in the above table, in the above mentioned points. The sites for health interaction are identified as 7. I have elaborated the professionals, the facilitators and the providers, healthcare providers in the previous slide. Now these are the possible sites where you can approach if you don't know anyone or you have some specific problem which you think that you have to approach the right site. The person can go directly and and approach these sites for their help. The first is the Health and Wellness Center, which is now called as Ayushman Arogya Mandir under Ayushman Bharat scheme. The second is Primary Health Center, which caters a population of around 30,000 population, can be approached for help in a local area. The health centers run by the public or private partnership under public domain or maybe under the private domain can be approached, because usually the health centers have medical officers, they have physicians, they have health workers, they have medical social workers, so they may help. The hospitals, which are the epitome of any services related with the healthcare, they can be approached. Hospitals can be approached anytime because they encompasses all the aspects. They have medical officers, specialists, super specialists, and down the line they have health workers, they have social workers, IEC workers. They also have many awareness generators, so they may be able to help you if you approach the hospitals. The next category comes as the pharmacy or chemist. I have already elaborated on that aspect. The event gatherings or assembly. These are identified as the good resource, because if you go in a particular cultural evening, if you go in a particular wedding area or any assembly, you may approach these professionals, because all of us are social professionals. So in a social activity, in a social gathering, we can utilize this opportunity also. And lastly is the home. Your parents, your siblings, your peer group may serve as your guide for on these many 7 sites. One of the critical site which I have already elaborated, that hospital which not only provides secondary and tertiary care but also offer valuable resources in form of education, counseling, because they have the counselors also, they have health educators also, screening, diagnosis, because they have lab facilities also, and the medication, because they have the pharmacy and chemist also. So in a way, these are the areas which can be identified and approached in case of any need. If you feel so that I am suffering with such and such problem related with non-communicable diseases, or if you want to leave the any of the addiction like smoking or alcohol, you may approach these sites and they may be able to guide you in general. The next group which are identified, which you can approach, is the self-help group of influencers, community workers, community health workers, and other professionals living in your own area, which can serve as a nodal point for your health related queries, to answer health related queries, and they may be able to provide you assistance, because they may be a local uncle, local chacha or local auntie, which can be approached for any of the help. The self-help groups are the platforms to voice health needs. Here you can raise your voice in relation to your health needs, that I am suffering with such and such problem, please guide me. So this particular group, on the basis of their own understanding of the problems, they may be able to guide you at the right point, at the right site, where you can approach on the basis of their experiences, and simultaneously they may give you some awareness regarding your issue, which can be resolved at that local level itself. Community mobilizers may also be identified, which for making the self-help groups, because usually self-help groups are a group of around 15 to 20 professionals, including the influencers, community mobilizers, and the cultural advisors are also part of the self-help groups, which can serve as a nodal point, can serve as an institution at the local level, and public in that particular vicinity can approach these self-help groups in case of need. Healthcare activities, and specifically these self-help groups, for mobilizing these healthcare related activities and events, they may raise funds, they may take funds from the Government of India, as there are many guidelines related with untied funds providing to the community health workers, through community health workers, for such type of self-help groups, which can be utilized for organizing health related camps and awareness generation camps. These self-help groups may facilitate community level services with the help of the raised funds. They may also provide the referral linkages, transport, and promote best practices of the neighboring area of their own, if they have that understanding of health related issues. These understanding can be enhanced in these self-help groups through the capacity building with the help of community health workers. And in a way, we empower them of these self-help groups, which may be of males only, which can be of females only. We can encourage Mahila Arogya Samiti or some women groups to be involved in such type of activities. So in a way, we constitute a group of skilled with the help of skilled manpower, with the help of capacity building in these areas. The activities which can be easily done by these self-help groups are they can help us, they can help the community health workers in identification of vulnerable groups and organize health promotion activities. They may support outreach sessions and referral transport in guidance of community health workers. The managing funds, records, they may be able to maintain the local records. In addition to the institutional records, they may also manage the records on their own, and local NCD related emergencies can be identified and their treatment points can be identified at their so-called self-help groups level. The filling scorecards. This is a new initiative which can be developed, scorecards can be developed for filling at the level of self-help groups for the purpose of identification of good practices at the health facility level and felicitation of the good workers or the facility in the community level, so that the good workers or the best practices can be identified and disseminated among the public, that this person can be approached or this institution can be approached in case of need. Community based monitoring system, CBMS, is a very specific and innovative idea with the help of which self-help groups can help the governance, the local governance, for highlighting the best practices, for highlighting the efforts of the community health workers, so that they may be felicitated at the right point. Organizing local meetings can be the easy and approachable aspect for self-help groups. They may organize various self-help groups in an area to bridge gap between the community and authorities and also help in grievance redressal. This is also a very specific aspect, that grievance redressal can also be done with the help of self-help groups. So local authorities or local governance can be approached with the help of self-help groups. Simultaneously, self-help groups may monitor various health schemes and private sector partnerships, and in a way they may be the main informer from the community for the health system. So community resources with the help of, if we give the self-help groups edge for serving in the serving for the national health programs, they may serve in a better way. I propose that in a particular local area of 1,000 population, at least 10 self-help groups should be there, so that 8 to 10 self-help groups should be there, or 15 to 20 professionals which can help in managing the things in easy way. And finally, we will be able to culminate with the NCD prevention and management services in better way. The community as a whole, with the help of self-help groups, with the help of community health workers, with the help of the various sites which I have enumerated in previous slides, may help in active enumeration of eligible population with maintenance of family folder. If a particular community or a family identified as hypertensives or suffering with diabetes type 1, which is a family problem in general, they can be enumerated in the health records, and finally this health records may give an extra edge for identification of possible emergencies in that particular family. The risk assessment using community-based assessment checklist. Risk assessment is identification of vulnerable population. That doesn't mean that a particular person is suffering with a disease. It's simple identification on the basis of the risk factors. It is called a CBAC form, which is filled with the help of community health workers and the self-help groups label. So, Anganwadi worker, ASHA, ANM and CHOs, these are the 4 professionals available at the peripheral side, at the local site for delivering on the various aspects of healthcare needs. They may fill these CBAC forms with the help of the community at the individual level, at the family level, or with the help of self-help groups. Community members may organize health promotion activities for the purpose of enhancing the education, for the purpose of behavior change communication. IEC is a very small aspect in which we give an awareness session for a particular community to enhance their information, to enhance their awareness with communication. But BCC is a long-term profile, behavior change communication. If I start giving awareness sessions today, then it will require another decade or more than a decade to transform this education or awareness session into practices. So, BCC is a bigger aspect which can also be done with the help of community members, but their willingness, their empowerment is required at every level with the help of facilitators, with the help of healthcare providers. Providing education community about healthy lifestyle. What is healthy lifestyle? That is the biggest query. Which is the right thing which I should do? It is said that everyone should walk. They should remain physically active. How a person can become physically active? That's a question usually public asks me in my interactions with the community level awareness sessions, that how I can remain active. So, my suggestion is at least walk for 20 minutes, start eating seasonal fruits, visit traditional practices, at least in India, that start eating fruits and vegetables available at the seasonal level, because we have some vegetables and fruits available in winters and we have some fruits and vegetables available in summers. So, we have to utilize these resources which are available with the variation of the seasons. So, healthy lifestyle can be pursued with the help of physical activity, eating right food and avoiding addictions like alcohol, smoking, etc. And fourth is the peace. Peace can be found with the help of meditation. So, regular meditation, right food and avoiding addictions, these are the things which can promote the healthy lifestyles at a community level or at the family level. The family centric care, if any person is suffering with any disease, any problem at the family level, their family members should be empowered with the help of awareness, with the help of enhancement of skills for the local level of care, which can be of great help to that particular community as their economics, the family economics will also be managed with the help of that. And the last one is the ensuring treatment adherence. If we are able to empower the families in relation to the care of that particular person, we will be able to enhance the treatment adherence also in relation to non-communicable diseases. So, there are three components: healthy lifestyle, family-centric care and treatment adherence. So, these three aspects can only be transferred or dissemination can be done with the help of communication, and we will be able to transform the society for caring each other in a particular community. Organizing health days and events to enhance awareness with the community health workers is a common practice in which people comes, take help of the particular healthcare provider, but they never come for the follow-up. So, follow-up is also a very important aspect in non-communicable disease pattern. If you don't follow, treatment adherence again requires a follow-up. So, the common points for these community resources are, I am just summarizing this, that every member which is suffering with a disease or having some risk factors should be identified at the community level by the community with the help of community health workers. That particular person should be identified, and if the person is suffering, that active enumeration should be done in the treatment aspect, and the treatment should be adhered with the help of follow-up activities, and this can be done with the help of family-centric care. This can be enhanced and this can be promoted at the local level. What are the usual barriers in the health systems which are identified for the which creates a barrier in utilizing the community resources are inadequate and overburdened workforce. In general, the ASHAs are available for around 1,000 population. Anganwadi worker is also available for around 1,000 population. ANM, every ANM serves around 5,000 population. Similarly, community health officers which are from Ayush background, means Ayurveda, Unani, Siddha and homeopathy background or nursing background, are available for your support, for your help. But considering the huge population in India, we require more number of such workforces. We have added ASHAs, we have added the cadre of ASHAs in 2005, and they provided a lot of support in engaging community for communicating such type of messages. The next tier which was added recently in 2017 were of community health officers. So, these tiers, and two tiers were already existing which were of Anganwadi worker and ANMs. These four tiers simultaneously work for the development of the population. Lack of funding support. This is again a issue which is identified at the local level, that many health centers say we don't have the enough funds to do the healthcare activities in the community. This can also be managed with the help of Panchayati Raj institutions, the Panchayat or community development officers. They may help you in providing the funds for organizing such camps. The lack of physical infrastructure, this is also a very big issue because many health centers have debilitated and poor infrastructures. This can also again can be managed with the help of community-based organizations or NGOs. Inadequate training and communication. This is also a identified section, that inadequate training and communication. Being a member of National Institute of Health and Family Welfare, which is an apex training institute, I have identified this as a bigger domain, and we usually give trainings to the national level trainers, state level trainers, which can later on show the cascade effect, so that every community member can be empowered in relation to the programs, national health programs run by the Government of India, and in a way our community may become healthy and you start doing the healthy practices. Inadequate coordination and engagement. This is also one of the very important aspects. Just to cope up with this issue, we may provide communication media, we can provide mobiles, we can provide, we can utilize ways of communicating issues from one higher authority to the local authorities and finally to the community health workers and the community, so that better coordination can be done. Communication is the key for better coordination. The local governance, the limited accessibility to the health centers and to the local authorities is an issue which is identified, and authorities are trying to address this issue. Cultural and social norms hindering healthy lifestyle, that is also a bigger problem, that women are not enough empowered to go out for routine walk in the morning hours, which are the hours identified as the easy hours where you can start your doing your physical activity with least of pollution. The volatile environment and challenging geography is also one of the important points. Tough terrains and hard to reach areas is also a point which is identified. Lack of confluence between government, politician and programmers. This is also a very important aspect, that cohesion of works, cohesion of objectives, cohesion of the mandates at the local level is sometimes is a problem area which is identified overall, which can be easily managed with the help of communication between the government authorities, politicians and programmers. Poor political advocacy. This specifically depends on the local leaders, local authorities, how they communicate the issues to the local political leaders and governance, so that inadequate local capacities can be enhanced for a wider picture, for a wider domain, which can be utilized for the purpose of NCD prevention and management activities. The health interventions are the key enablers which can be utilized. This is a long list which can be utilized as a bigger community resource and processes. Community health workers led knowledge dissemination events, efforts in the local level is a very big domain. We are doing this, but if we do with the help of self-help groups, we may be able to percolate in better way in a particular local community. Strengthening of outreach services and outreach sessions is also a very big key. If we can organize camps in hard to reach areas, tough terrains, then we may be able to showcase our activities, and simultaneously we may build up the confidence of the community for the health system. Enhanced accessibility, affordability with quality health services is also a very important area, an enabler. If we can do something for this accessibility, we can, if our health centers are at a remote area, we may organize a fixed day camp for enhancing the accessibility, for enhancing the affordability, because if we enhance the accessibility, we may reduce the cost by making it more affordable by coming to their gates, by coming to their houses, and we may be able to give better qualities with least of efforts, and people will start approaching us in the health camps. The increased community participation in peer-to-peer education and awareness campaigns can only be done if we utilize the already mentioned self-help groups, Mahila Arogya Samiti, Jan Arogya Samiti, and other already identified things which can be utilized for the purpose of increased community participation, increased community mobilization can be done with the help of that. Community empowerment for NCD prevention and health promotion can only be done with the help of increased community mobilization. And this community mobilization, again I am emphasizing, can be done with the help of TRIO. That TRIO is political leaders, government authorities and the community, offering integrated and personalized care. If a person comes to you for help on a particular aspect, that opportunistic screening should be done at that particular point. For example, if a person comes to you for the purpose of ophthalmic examination, ophthalmic assessment or eye assessment in relation to specs or spectacles, you may utilize this opportunity for screening him or her for non-communicable diseases like BP measurement. You may go for anthropometric measurements, you may go for the declaration of the obesity and other aspects. So, you may identify that particular person on the basis of the already identified risk factors and measuring the indicators, he or she may be counted as one of the diseased professional, diseased person, or professional help may be sought for him or her. The need assessment of physical and psychosocial health of community members by self-help groups. It is again a very important aspect which can be tackled with the help of self-help groups. Which family is requiring the psychosocial health support if a family is suffering with a problem of economics, like the main bread earner of the family is diseased. In that case, self-help groups may help with the help of funds, with the help of guidance, with the help of providing opportunities to them, to other members, by guiding them for better care of the person and better care of the family in this way. The capacity building of healthcare workforce is also a very important aspect. Capacity building should be done by the workforce, higher workforce on regular basis, so that not only capacity building is an aspect which can be done on the routine interactions on the various platforms. You may enhance the capacity of a particular person or particular professional on regular basis on routine interactions in addition to the training program. So, emphasizing the identified points on regular basis may build the capacity of the healthcare workforce, which ultimately percolate down and enhance the local health activities in a better way. Strengthening local health governance in financial planning and management so that fund availability at the local level should be ensured with the help of the local authorities. The accessibility and affordability aspects can be addressed with the help of better financial planning. The community-based monitoring of healthcare facilities is also a very specific domain. Many a times people complain that that particular healthcare providers doesn't come to my community, doesn't come to the healthcare center. Healthcare centers are not opening on regular basis. So such type of monitoring can be done with the help of self-help groups, with the help of local community influencers, which may later on communicate this problem to the higher authorities so that a community-based monitoring of healthcare events, that how many events are organized by the government of India or by the local governance for enhancing their knowledge on the various aspects of non-communicable diseases can be monitored with the help of communities so that the programs, the healthcare schemes can be delivered to the remotest site and to the right person. The policies which are identified to manage non-communicable diseases and the initiatives done by the Government of India at the national level are enumerated in this particular slide. I am simply elaborating these initiatives of Government of India. In 2017, National Health Policy, which is the third policy in line after independence in Government of India, outlined goals and objectives for reducing burden of non-communicable diseases in alignment with Sustainable Development Goals of global importance. We have launched National Program for Non-Communicable Diseases, which was running previously in various other domains. We have encompassed every non-communicable disease program under the head of National Program for Prevention and Management of Non-Communicable Diseases. Under this program, we have established 770 district non-communicable disease clinics, 372 district daycare centers, 233 cardiac care units, and 6410 community health centers. The NCD clinics have been set up to enable effective screening and monitoring of NCDs. This screening also includes the opportunistic screening, the population-based screening. Both are done with the help of non-communicable diseases. Now, under this NCD clinics, a population-based initiative for screening, management and prevention of common NCDs has been rolled out as a part of comprehensive primary health care in the country under the National Health Mission. National Health Mission is a program which was launched in 2005, is a key changer in performance of various national health programs in India, and it has launched a specific population-based initiative for managing and prevention of non-communicable diseases. We were having the primary health care guidelines since many years, but they have introduced a CPSC for universal health coverage, that is community comprehensive primary health care, and we have incorporated NCD prevention and management under this particular comprehensive primary health care domain. In addition to eye care, elderly care, emergency care is also included under comprehensive primary health care domain. Initiatives for increasing public awareness about non-communicable diseases include promotion of healthy lifestyle by leveraging the power of print, electronic and social media platforms. So we started providing e-health programs, we started providing many applications. NCD portal is also there for the purpose of information, and specifically e-Sanjeevani program is there to handle the routine queries and routine issues related with NCD management at the local level, which is addressed with the help of community health officer, who is identified as a key coordinating point at the Ayushman Arogya Mandir or sub-center, which provide the platform to the local community to interact with the medical officer or the specialist through the e-Sanjeevani portal. At community level, Ashas emphasize the significance of early detection through regular health checkup. So, Ashas and Anganwadi workers, they encourage regular health checkups and screening, encourage communities to enable their timely initiation of the treatment, timely intention of the right time for the intervention, right time for the home visits for the purpose of treatment adherence, and encourage them for the health campaigns, participation in health campaigns. So in a way, I have summarized many things, I have covered many things in relation to community resources, community processes. I have highlighted the efforts of Government of India. I have highlighted the non-communicable risk factors, their processes, and how we can cope up with this specific domain of non-communicable diseases which cannot be transmitted from one person to other, but can be transmitted through genetically, which we can cope up with the help of modifiable risk factors and regular healthy lifestyle can prevent these non-communicable diseases. National program for NCDs entails comprehensive interdisciplinary approach that takes into account the broad contest scenarios. So health system in general can be strengthened with the help of national programs, the management and prevention of non-communicable diseases at the community level, a clear understanding of community resources, the interventions possible at the community level, their mechanism of action, their raising of funds and their health economics at the local level, and how to cope up with the constraints which are faced on the regular basis is the best way of effective delivery of NCD health schemes, non-communicable disease prevention schemes at the local level, and to reduce the non-communicable diseases burden in the community at a large. So live healthy, and a lot of thanks to you for bearing with me. Thank you.